Oh, just take your time now, please.
Okay. As you can see, he's in a tremendous amount of pain.
Amen.
Okay? And again, remember that pain is the alarm. It's not really the problem. It's his problem, and what drove him to be here is the pain. But the pain is really what's telling him that there's a problem in the structure of his spine. Just so you know, I have treated him before, so this is not the first time he's getting a chiropractic treatment. So that's why he's not going through at this point the full examination with x-rays and everything else. Now, what's interesting when you do what he did, he has what is known as an antalgic lean. An antalgic lean is that the body looks to protect the area that's been pinched. So it won't let him stand up straight no matter how hard he tries to stand up straight. Why? Because of the fact that if he stands up straight, it's going to put more pressure on the nerve and give him more pain. So the body is always looking to protect itself. That's how God installed this innate intelligence in our body, so that it always is looking to fix itself. It's always compensating in one way or another for things that are not quite right. So then he uses someone like me, who's a chiropractor, as a vehicle, who's been trained in getting these vertebrae that may be out of alignment into place, taking the pressure off the nerve. Sometimes we see an immediate miracle, and sometimes it takes a little time for the nerves to heal. And what we're looking for today is for God to intervene and for us to have him walk out of here feeling 95% better. How does that sound? I'm sure he would consider it.
To the Big Bang, Doctor.
I'm sure you would consider it a miracle if you walked out of there at 95% better. Turn on this side, facing me this way.
Turn on
the side, left side down, facing me.
Look towards the wall.
Okay.
Now this is the interesting thing is overcoming. When I first started in practice, every time I had to do this treatment, I used to have to bite my lip. Because when a person is in the amount of pain that he's in, the last thing in the world you want to do is to go into that area that's painful and move things around. But if you've ever watched somebody who does karate and they take a brick and they go boom, and they do it real fast and the brick breaks in half, well, the same kind of principle is the same in what I do here, is that I get in and out of there so fast in the movement that I make that it's before it even registers as far as pain is concerned. So although it may seem like something that would be very painful, and he may scream and yell a little bit, who knows, but the point is that it's not really creating any additional pain for him. Nice and relaxed, let it all go, let it all go. Good. Now the other side. Now there was a little click and a pop in there, the vertebrae moving into alignment, that I had felt was out of place.
The same technique you use when you're moving a patient.